I'm going to talk a little bit about cellulitis. Cellulitis is a common infection of the dermis and subcutaneous tissue that can occur when bacteria enter a break in the skin and then spreads, and then the result is infection. Cellulitis is mainly caused by Streptococcus pathogens or Staphylococcus aureus. Other less frequent isolated bacteria include Pastorella from insect or animal bites, and non-typable streptococci or Bacillus anthracis that's associated with intravenous drug use, and then also Vibrio or Aeromonas due to skin wounds obtained in seawater. Cellulitis is not commonly spread from person to person. It is more often caused by bacteria that normally live on the skin's surface. It can occur as an extension of a skin wound, of an ulcer, or from the furuncles or carbuncles. It is associated with chronic venous insufficiency and stasis dermatitis. Risk factors can include diabetes mellitus, edema, peripheral vascular disease, tinea pedis, insect bites, or any suppression of the immune system. Symptoms for cellulitis can include pretty severe pain, tenderness, redness, inflammation in the affected area, a skin sore or rash that appears and grows very quickly. The skin can be tight, kind of glossy, swollen. There's going to be a feeling of warmth around the affected area. A central area that has an abscess with pus formation and a fever can also be present. Providers can usually diagnose cellulitis on site. They will perform a physical exam to determine the extent of the condition upon the swelling of the skin, the redness, warmth of the affected area, possibly even swollen glands. Depending on the severity of the symptoms, the doctor may want to monitor the affected area for a few days to see if redness or swelling spreads. In this photograph here, we have got where someone has taken a pen and kind of marked the borders of the affected area. This will let the providers know and the nurses know how the treatments are affecting the area, if it decreases in size or if the area spreads. In some cases, the medical provider may perform a blood draw or culture of the wound to test for the presence of bacteria to see if the treatments are applicable. Here we see cellulitis present in the patient's left eye. Here another photograph with several different pictures that show how cellulitis can affect the periorbital area. This photograph shows several other skin disorders in comparison to cellulitis. Cellulitis depicted down at the bottom right of the photograph in comparison to some other things. It's really important to be able to differentiate cellulitis from other similar skin disorders that can also be pretty common. It is vital to differentiate cellulitis from necrotizing fasciitis. Necrotizing fasciitis is a very rare but rapidly spreading inflammation starting in the fascia, muscles, and subcutaneous tissue with subsequent necrosis of the overlying skin. This photograph shows a picture of necrotizing fasciitis, and it really is hard to differentiate between necrotizing fasciitis and cellulitis. Treatment for cellulitis is going to be antibiotics that should definitely cover staphylococci and streptococci. Also, boro soaks can be used to relieve pain. And also corticosteroids are often used for adjunct therapy.